Thank you. It's an honor to be here, especially to follow Rafi, my mentor and surrogate uncle. On this slide, you'll see my email. I'd be happy to hear from you afterwards. Part of this talk is contained in an article that was just published last week that I'd be happy to send to each of you. So here I am on the high wire without a net, trying to do an hour presentation in 15 minutes. So let's begin. There's some disparate threads here I'll try to tie together and hope that it becomes coherent at the end. The human gut harbors 100 trillion microorganisms, and there are 10 to the 12th per milliliter of these. Their genome exceeds that of the host humans 100-fold. There's a difference in obese humans. They have more of a type of bacteria called Bacteroidetes, lower Bacteroidetes and higher Firmicutes. This fellow, Dr. Moeller, did a very interesting study. They actually went and sampled in the field fecal samples from wild chimps, bonobos, which are pygmy chimps, our closest genetic relatives, gorillas, and human populations. The microbiomes of American humans are more different from those of Malawi humans than the gut microbiomes of Malawi humans are from bonobos. And you see the p-value there. You never see values like this unless it is a clear finding. Looking at 3 different continents in humans, there were lower microbial diversity than in apes with respect to the bacterial phyla, classes, orders, families, and genera. There's a constriction of the diversity. Americans average 30 fewer bacterial genera, the lowest level of diversity. These changes have been associated historically, epidemiologically, with vast increases in gastrointestinal disorders, obesity, and especially autoimmune disorders. The same group did a subsequent study, again, showing that there are also anatomical differences. In apes, the colon is greater than 50% of the intestinal volume versus only 20% in humans. It's clear that several bacterial lineages have seemingly followed evolutionary-wise with hominids over the last 15 million years. And again, in industrial nations, humans harbor the fewest genera of any primate. There are 2 Bacteroideaceae lineages in apes that have never been found in the American human subspecies, as I like to call it. The severity of irritable bowel symptoms is inversely related to the gut bacterial diversity, so this definitely has importance to disease. So what is a person to do? Well, I'd suggest these things. First, probiotics that may be familiar to some of you. These are oral supplements of beneficial gut bacteria that can be supplied as capsules or in fermented foods, especially kefir, lacto-fermented vegetables, to replace the kind of thing that is missing. And then you need something that those bacteria like to eat. And those are probiotics. These are oral vegetative matter, indigestible sugars and fiber, fructooligosaccharides that serve as a feedstock for the beneficial bacteria. Some other studies looking at the relationship between the microbiome and psychology. When people ingest Bifidobacterium and Lactobacillus probiotics, it reduces negative mood, a treatment for depression. Probiotics, these special bacteria, in elderly patients improved attention and working memory as compared to placebo, and that was statistically significant. There's some diseases, particularly Clostridial infections, that are treated with fecal transplantation. When this was done in autistic children, there were improvements in the behavioral and GI signs and symptoms over the course of the ensuing 8 weeks. Presumably, this is something that needed to be repeated. Again, the gut microbiota, these different bacteria affect neuropsychiatric status in such conditions as autism, depression, stroke, and schizophrenia. And the mechanism of action seems to be mediated through the autonomic nervous system, the enteric nervous system, the immune system, and relates to bacterial metabolites. And I'm going to suggest now that there's a role for the endocannabinoid system here. Again, we've seen marked changes in the human diet as compared to past centuries. And at the same time, we've had skyrocketing rates of chronic disease, specifically obesity, inflammatory bowel diseases, other autoimmune diseases, allergies, diabetes, cancer, depression, and neurodegenerative disorders. And these were not rare in past centuries merely because we're living longer. It's demonstrable that there are more of these per the population. Apparently, it's necessary to have multiple probiotic species, not single ones, to protect against pathogenic bacteria like Clostridia and to gain these neuropsychiatric benefits. So, additionally, probiotics may help control PPAR gamma. This is a nuclear receptor you're going to be hearing a lot more about. It regulates gene transcription. Recently, it was shown that cannabidiol and also THCA, tetrahydrocannabinolic acid, are agonists of this receptor. And it's been called the master regulator of adipogenesis, the production of fat. Also regulating tumor necrosis factor alpha, which is important in autoimmune diseases and in inflammation. Prebiotics, so those vegetative matter that the bacteria like, change the microbiota to reduce fat production and stabilize the gut so that it doesn't leak and allow toxic metabolites to enter the bloodstream. We also know that CB2, the non-psychoactive cannabinoid receptor levels, correlate to concentrations of lactobacillus, what's in yogurt, and negatively with Clostridial species that are often pathogenic. A study that directly relates to the endocannabinoid system is this one from 2007. Lactobacillus acidophilus, common component of yogurt, specific strain of that was administered and induced CNR2, that's the gene that produces the CB2 receptor, its RNA expression above that in the human HT29 epithelial cells, and that was statistically significant. So they demonstrated that as well as an enhancement of morphine's pain-killing effects in rats, highly statistically significant. And that reduction in pain was inhibited when a CB2 antagonist was administered. So that fits together. A very interesting study from 2011 looked at obesity in cannabis users and non-cannabis users. What they found was obesity rates were only 14.3% and 17.2% respectively among participants using cannabis at least 3 days a week. So that's a 1/3 reduction over non-users. Additionally, those who use cannabis had significantly better body mass indices. Do you know what yours is? Another study directly relating cannabinoids to this issue was done in Calgary, published in 2015 by Nina Clooney and the group there. DIO mice have a genetic susceptibility to obesity. They gain weight on the same dietary intake that doesn't affect others. When administered THC that altered their microbiome balance, affecting the Firmicutes and Bacteroidetes ratio. The THC essentially prevented the ratio increase or weight gain despite being on a high-fat diet. So this could help explain what we observe in humans, as we'll see from these demonstrations. People who use cannabis suffer from a variety of stereotypes. The most common one is the cannabis user as a lazy slacker stoner, as we see in the illustration. But another one is that of the skinny hippie. And you see that he's got a grocery bag full of vegetables, hopefully the right ones. But the truth is that the skinny hippie is the more accurate representation of what a cannabis user is likely to look like, as opposed to the slacker stoner. Again, how do we change the way things are and this destiny that our diet has seemed to impose upon us? Well, in this prebiotic array, you see some vegetative matter that may be quite unfamiliar to you, starting with acacia fiber in the upper left, chicory root, sometimes used as a coffee substitute, sunchokes, otherwise known as Jerusalem artichokes, then dandelion greens, burdock, and then the more familiar Eliaceae, your onions, leeks, and garlic. All of these feed the beneficial bacteria in the gut. Additionally, another thing that's changed about our diets is our vegetables have become tasteless. In ancient times, people ate what they could gather, and it included a lot of bitter herbs. And these have largely fallen out of the diet. Particularly Americans like things that are sweet and not bitter. This can be supplemented with herbal bitters, as demonstrated in the photo. And it's been shown that these are present not only in the tongue, but throughout the gut, and specifically in the brain, where they do such things as reduce hunger drive, the drive towards sugars, and also seem to correlate with reducing such disorders as diabetes and even acne in the face. So the question is, can bitter herbs allay hunger via the hypothalamic and ECS-mediated mechanisms and lead to weight loss and counteract the metabolic syndrome and type 2 diabetes? I believe the answer is yes. Here are a couple of books on how to eat. Nourishing Traditions by Sally Fallon, which first came out in the 90s, but still presents a very relevant diet. The more recent bestseller by Perlmutter called Brain Maker, correlating use of this kind of diet with prebiotics and probiotics to improvements in autism and a variety of other neurologic conditions. My hypothesis would be that we're seeing common mechanisms between the prebiotic and probiotic diet and what cannabis can do. And this has led to this diagram that was published last week, what I like to call the gut or grand unified theory that relates the microbiome to treatment of various diseases, including especially beta amyloid formation, neurofibrillary tangles that are associated with Alzheimer's disease and a variety of other neurodegenerative conditions. And as you see from the diagram, it's not only beneficial bacteria, but there's abundant evidence presented in the paper, but not here today, that supplemental THC, CBD, and even THCA may do similar things in allaying these type of afflictions. So this suggests a new approach to neurological therapeutics. I have always said throughout my career that it needs to be a preventative and therapeutic specialty rather than just a diagnostic one, to provide better treatment for epilepsy, tumors, Alzheimer's disease, Parkinson's, traumatic brain injury, and chronic traumatic encephalopathy. Part of this includes aerobic activity, which is known to stimulate the endocannabinoid system. Education throughout life seems to help prevent dementia. And above all, an anti-inflammatory prebiotic and probiotic diet that should emphasize saturated and monounsaturated, that's olive oil, as we heard previously. Also omega-3 essential fatty acids, bioflavonoids from things like berries, fermented foods, protein, and minimizing carbohydrates, which have only been used in abundance by humans for about 3,000 years. Additionally, this can be supplemented with cannabis extracts providing the THC, CBD, THCA, caryophyllene, and other select terpenoids.
3 minutes remaining.
Well, we made it. So, I guess people can come to the microphones and I'll attempt to answer questions. I did not plan that to come out within seconds. Any questions?
So if you took, is this on?
The microphone's on. Just please talk closer.
Okay. So if you took my bacteria, my gut, and I would imagine my Firmicutes and Bacteroidetes level is a good one in that I would have lower Bacteroidetes and higher Firmicutes. If you took that and transplanted and did a fecal transplant into someone obese, what would happen?
They would expect an improvement in their weight and intake. But again, it might be a temporary phenomenon. Now, it works the other way. There is a rodent model of Parkinson's disease, and when you take the fecal matter from the affected mice and put it in those that aren't affected, they become symptomatic. So this is being used a lot now in gastroenterology practices to try and improve the situation. The most common situation is treating clostridial infections that are really recalcitrant, and a lot of that is a function of antibiotic use. And I would point out that part of the reason we're having so much trouble with these autoimmune diseases is not just changes in diets, but overuse of antibiotics that are suppressing normal,
1 minute
desirable bacteria.
So follow-up question, I was surprised you didn't talk about antibiotics more in this talk because...
Well, we only had 15 minutes.